Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And today we're going to talk about a new service being offered by Northwell Health called ER On Demand, which offers overnight virtual emergency care service. Our guest today is Dr. Shelly Razack, a New York-based Northwell Health physician who specializes in emergency medicine and participates in telehealth medicine. Dr. Razack, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you. Thanks so much for having me today.
So to begin, tell us about how you're doing in this pandemic. Have you been personally affected?
I am very grateful that I have not personally been affected, and my family's been, they've been good throughout the pandemic. But I guess you can say I'm personally affected in my job. I worked in the emergency department all throughout the pandemic, and in the very start of the pandemic, I was the third year resident. So it was definitely eye-opening. I remember when we thought this was not going to affect us. This was, in a different country, and then hearing, well, there are a few cases and there are very strict criteria for people that were testing, that were suspecting it. And all of a sudden it became something that we were concerned about, that it was in the community, and what do we do? And it was interesting to practice and have all these protocols, and things were changing day by day. And I was so grateful to work for Northwell and for such great leaders who are really pioneers. And, we started wearing masks in the emergency department and mandating things before it became public, because it did make a difference. And it was nice to feel like we were protected at the same time as we were trying to protect our patients. We were definitely nervous about patients in general. I mean, it's a terrifying time to not understand what's going on with yourself and to not have your family at the bedside. So I really felt for them.
So tell us a little bit about you and what made you become an emergency medical doctor.
Emergency medicine is such a great way to get to know your community. We do have a broken healthcare system if you think about it. Not everyone has access to care. Not everyone has a primary care doctor. And a lot of times people are using the ER as a safety net. I love being in the emergency department because we're there to help stabilize patients, to see patients when some of the scariest times in their lives. And so to be familiar with this idea of providing care to patients when they need it the most and to be a net for patient, I think that being able to now expand that into telehealth and work with ER on demand to now even create another net for the healthcare system, it's amazing.
So some people think of telehealth as a new technology that was invented because of the COVID pandemic, but it's been around much longer than that. Can you speak about how long it's been actually around and tell us a little bit about the technology?
Telehealth has been around before the pandemic, definitely not to the extent it is now. And I don't know that anyone could have predicted it would have blown up in the way that it did in the past 18 months. But even before this, within the healthcare system, we've been utilizing EICUs, telepsychiatry in the emergency department. We use teleneurology for stroke consults. So we're familiar with it. But I think that the pandemic really opened our eyes to how much we need to be able to expand it to increase access to patients.
I recognize the need for it, particularly during the COVID pandemic. Does it seem kind of personalized? Do patients complain about it being impersonal?
It's funny that you say that, because I think it's been the complete opposite in terms of the feedback we're getting from patients. Because we are relatively new, we're always looking to find ways to improve on our process. And so we ask patients for feedback. And a lot of times they're so amazed at how comfortable we're able to make them feel just by having a video encounter. I mean, if you think about it, patients are literally inviting you into their homes. You're on a camera. They're sitting in their living rooms or wherever else. And so it becomes really important to have not just a good bedside manner, but to also have a good camera side manner to understand how important communication is. And I think that that's something that is really apparent in telemedicine. I'm sure people are familiar going into a busy emergency department or a busy doctor's office and feeling like they're just like boxes being checked off in terms of things that you have to go through. With telemedicine, it becomes even more important to sit back and listen to patients and understand what their concerns are and understand whether or not this is something that needs to be escalated. Does this person need to go to the ER? Are they safe to see their primary care doctor in a few days, or should I be linking them into a specialist to follow up?
So tell me about this new service called ER On Demand. What is it and how does it differ from telehealth?
So ER On Demand is a unique telehealth program because we're providing acute care for patients when they need it. We have a group of really talented board certified emergency physicians from Northwell Health. And our goal is really, again, to meet patients where they are. So we're here when urgent cares and doctor's offices are closed overnight, and we're providing the service that didn't exist before. So not only are we able to screen patients to say, I think that this probably warrants you going to the emergency department, but we're also able to reassure patients and say, I think you're okay staying home through the night. You're right. You probably don't need to go to the hospital right now. But we're also treating anything from UTIs, rashes, upper respiratory infections. We're here for all of that. But we also lean into the hard stuff. And I think that's what really distinguishes us from other telehealth programs. We are partnering with our colleagues to take care of some of the sicker patients within the healthcare system. So if we can see them remotely and help prevent a hospital readmission and keep patients safe at home, I think that's a huge value add.
So with ER On Demand, is this continual care for particular patients, or is just one time where a person may have something acute to happen to them that they can call into the ER On Demand?
It is more acute care. We're not primary care doctors where we have a patient base of patients we're following. But we always welcome patients. If they need to be seen again, they can always reach back out to us. And we also want to make sure that we're doing right by our patients. So it's a little bit different. You go to the ER, you see a physician, and they have you follow up in the outpatient. And sometimes we can look up patients to see what happened and if they end up following up, what were the next steps. Here, we're taking a little more control of that. We're calling them the next day to say, hey, how are you feeling today? Are you better? Are you worse? Did you have to call your physician? Did you have to go to emergency department or urgent care? And what are some of the next steps that we can take? And if we haven't already plugged them in with a follow-up appointment, if at that point they feel like, I think I need to see a cardiologist, we can say, okay, well, we can help you do that. We have the resources so that we can have someone call you and help make that appointment. And it's great to be able to offer that service.
Is this service available 24/7?
It is, yes. When we first started the pilot, we were targeting mainly the overnight hours, 8 p.m. to 8 a.m. But we've since expanded. We offer services 24/7.
So how does it work?
Sure. So we do have a phone number that we're affiliated with. We can find on our website for ER On Demand. When a patient calls in, I think another thing that makes us very unique is that we've really tried to make this a seamless process for patients, and we want to make sure that our patients are safe. We don't want patients waiting to be seen for telehealth if they're having a heart attack or something that sounds very scary. So we have them call into our Center for Emergency Medical Services. They'll either speak to a paramedic or an EMT who has kind of a protocol to follow in terms of questions to ask. So if someone says, I'm having chest pain and I'm nauseous and vomiting, I'm sweating, and it sounds like a heart attack, we'll probably say, I think you need an ambulance, and we can offer that to them. If it's something lower risk that sounds appropriate for telemedicine, they go through the same process they would go through if someone were to call for an ambulance. So they're getting the patient's name, their address, all the information that's relevant. The patient is then transferred over to the patient access services who does the registration for the patient. And then at the same time, the physician is being notified. So within most times 20 minutes, a patient is seen by a physician. And the reason this is so great is that if I see a patient and maybe initially it seemed like they would be appropriate for telehealth, but they're telling me something a little more in depth that sounds like they should be taken to the emergency department or go themselves, I can say, we can offer you an ambulance. And it's very easy to continue that process and say, please send an ambulance for this patient. Or the patient might say, you know what, I'll go myself.
You're listening to Your Family's Health on the Voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning all about new service that's being offered by Northwell Health called ER On Demand, which offers overnight virtual emergency care service. Our guest today is Dr. Shelly Razack, a New York-based Northwell Health physician who specializes in emergency medicine and participates in telehealth medicine. You talked about the connection between the ER on demand and the ambulance services. So the ER on demand physician, who is the one that happens to be communicating with the patient, if they deem it necessary, they notify the ambulance to pick up the patient at their home. How does the connection work?
Most patients who are calling in have a feeling that they might be able to stay home, or that their problems might be something that can wait, but they're not really sure. They're looking for guidance. I would say about 10% of the time we are escalating to have patients go into the emergency department. If the patient immediately calls and there's something that sounds life-threatening, they're sent right away from that CEMS agent who will say, I think you need an ambulance to go to the hospital. But most often, patients will have a telehealth visit. So within 20, 30 minutes into the process and having spoken to the physician, we're saying, I think you need to go to the hospital. But I would say, again, 90% of the time, we're seeing conditions that can be treated from home.
How does that work, telehealth, with the patient insurance? Is this covered as it would be a regular visit to the emergency room, or is it different, paid differently?
It is different than going to the emergency department. It's billed as an ambulatory visit. So similar if you were to visit an urgent care or your doctor's office, most insurances do cover it. And if patients have any issues with paying their bills, they can always call financial or assistance.
What is the experience level of the ER on demand physician? I would imagine that there would not be residents. There would it would be required for them to have a certain amount of years of experience.
Absolutely. We have all board certified emergency medicine physicians. And beyond that, most of our physicians are specialty trained. We have physicians who are trained in toxicology, ultrasound, sports medicine, administration. So it really gives a unique edge to the physicians that we work with. And besides having all these clinical skills, again, having strong bedside manner, camera side manner, being able to listen, and having those technology skills to troubleshoot. I mean, you can imagine it doesn't come easily for everyone. And so sometimes we're calling patients to try to help them figure out how to get onto the app and how to connect their audio. Or maybe sometimes we have to know when to switch platforms because it's not working out, or when we should say, okay, we can try another way to make this work for you.
So I would imagine that the audio and visual would have to be working at its optimal level on both sides of the end, your side as well as the patient side. And so that what happens if the patient side, they don't really have access to adequate audio or visual? Is it therefore escalated because we don't know? There's a level of unsurety as it relates to how the patient's condition is.
So there is a difference between having a telehealth encounter using video and one using only audio. You can imagine if there are limitations with using telehealth through video, that there are even more limitations through audio only. So it becomes discretionary at that point. And most times we can still offer a visit for patients, but then it becomes a little more limited because we won't be able to watch the patient do some physical exam techniques that we're going to talk them through. So it's a balancing act.
And because it's an ER on demand and a patient is having a very acute experience, such as shortness of breath, you would be able to kind of guess on some level, based upon your assessment skills, that this is a serious matter. So I'm going to escalate it automatically without sufficient audio or visual. So
we always at least need the audio. We won't be able to even have an encounter without the audio.
Okay.
In terms of something like shortness of breath, I think that we're also really grateful to have our CEMS team to do that initial intake to make sure that those first questions that you would want answered are taken care of off the bat. So sometimes you might have someone who says, I'm short of breath, and we do an encounter and we look for things like, is this person speaking in full sentences? Does it look like this person is really like using their muscles to breathe, or they're having a hard time just catching their breath? And right away, it's okay, well, you know what, this needs to be escalated. And if they seem more comfortable, then, well, describe more about the shortness of breath, because my impression is that these are all the things that you're telling me that we can continue this encounter and figure out where to go next.
So tell us about some of the most interesting things you've managed without breaking HIPAA law. Just tell us maybe some of the most interesting patient cases you've seen over the time that you've been doing this.
So telehealth really gives you an opportunity to be creative in the way that you're treating patients, because I always tell my patients it's different. I'm not in front of you. I can't use a stethoscope to listen to your heart and lungs. So I will need some of your assistance. So sometimes we'll have patients press on their abdomen and we'll show them how to do that. And a few of our doctors have had patients where they were concerned about the exams that they had, and it ended up being something surgical, something they need to go to the emergency department for. And being part of Northwell, we're fortunate that if we send our patient to an emergency department, they opt to go to one of our ERs, we can follow up on those patients. We can call to give a warm handoff, and then we can kind of follow up on what happened. So we were able to follow up on these cases and really see that these visits to the ER were warranted.
So how has the ER changed, or even ER on demand changed since the height of the pandemic?
It's interesting. In the beginning of the pandemic, the ERs were flooded. I think you can remember when people were telling people to stay home unless they really needed to go out. And I remember being overwhelmed with the amount of patients that we were seeing. And then around probably the summer last year, we started seeing lower volumes in the emergency department. But even through the height of the pandemic, I think we always wondered, where are these quote unquote bread and butter cases that we're used to? So the chest pains, the belly pains, things that people would normally come in for. And so what we were starting to see was that people were really scared to come into the ER and scared to come into the hospital. And I think that really is what helped give birth to this program, ER on Demand. We wanted to make sure that we're able to still provide a service for all of our patients.
So tell me more about the people, the professionals you work with ER on Demand. Are there different types of doctors? You talked a little bit about you have various specialties. Do you also have nurses? Tell me about the healthcare team.
Sure. We have a fantastic team. We work with, again, paramedics and EMTs at the Center for Emergency Medical Services. We're working with patient access representatives, our entire administrative team, and physicians. Right now, our telehealth calls are taken by emergency medicine physicians, and everyone is so invested in the success of this program. It's, I think everyone has a passion for exploring this unknown territory of emergency medicine and really trying to figure out how we can expand our footprint. So some of our docs are doing research. Others are trying to really make this standardized and develop resident curriculum so that this can be something that's lasting. And others are collaborating with colleagues across the health system to bring patients into our telehealth service that they would probably otherwise send to the ER.
You're listening to Your Family's Health on the voice of Nassau Community College 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about a new service being offered by Northwell Health called ER on Demand. This offers overnight virtual emergency care service. Our guest today is Dr. Shelly Razack, a New York-based Northwell Health physician who specializes in emergency medicine and participates in telehealth medicine. Where do you see the future of telemedicine going? We've made big strides in terms of getting into the homes of people who have the need for this emergency care. Where do you see the future going?
I don't think that telemedicine is going to go away. I don't think it's necessarily going to take over our standard in-office visits either. I think it's meant to be supplemental, and it's meant to really help us reach all populations. We kind of call it this concierge medicine for all, because we're proud to have that role, to be able to give patients another option. And, what we're really doing is we're building the service with all that Northwell has to offer. And I think the possibilities are endless. So we're kind of this startup within a large healthcare system, but it's nice to have that support. And so I think there's so many ways to continue growing, and I'm excited to see how that happens in the next year, or next few years, I should say.
Me too. Just changing it a little bit. Tell me about the vaccines, and what would you say to someone who is still hesitant about getting the vaccine, the COVID vaccine?
I encounter this in the emergency department. I have patients who come in and if there are any respiratory complaints or flu-like illnesses, I'll often ask, are you vaccinated? And if someone says no, my first question is always, well, why not? And I don't mean that in a judgmental way. I always want to know what the reasons are behind it. Because sometimes it's religious, sometimes there are misconceptions, other times there are fears. So I think really understanding where people's fears come from or where their hesitancy comes from can help us to at least start the conversation. And so my goal in having these conversations is always to educate. In medicine, we're always taught to kind of avoid being paternalistic. We always want to partner with our patients and have some shared decision making. But when it comes to the pandemic and it comes to vaccines and it comes to something that is so important for public health, it makes a difference. And so all I can do is educate and give the reasons why it's important to get vaccinated, what this means, and what kind of address some of those misconceptions.
So if a patient comes in and has not received the COVID vaccine, can they get one in the ER?
If someone comes in and has not gotten the vaccine and they're not having any current COVID symptoms, they don't test positive for COVID, we can offer that to them, yes.
So what do you think about the COVID booster? Tell me about its availability and what do you teach or speak to the patients about the booster?
I would suggest the booster vaccine for patients who receive the Pfizer vaccine. Right now, the recommendations are for anyone who's 65 and older, long-term resident and care staff, anyone who's 18 and older with underlying medical conditions, and those who are 18 and over and work in high-risk settings. We know that the vaccines have been incredibly effective in helping to reduce moderate and severe disease. And I think that by getting the booster, we can continue to...
Oh, you're right. Continue to decrease the, right.
Yep. So by getting
severity.
The booster, it helps us to make sure that we're not decreasing our immune response to COVID.
What are your thoughts on mandatory vaccinations for healthcare workers or healthcare professionals? It is mandated now that healthcare professionals have to have the vaccination.
I think whenever we hear the word mandate, we feel like our personal rights are being infringed upon. And it's a scary thought for everyone to feel like they don't have a choice in this. When it comes to healthcare and it comes to working in a stressful and also high-risk area, we have to consider the risk associated for ourselves and those around us. So even talking about a mandate, it is a public health emergency. We are in the middle of a pandemic. And when we think about prior mandates, looking at the polio vaccine, guess what? We're not seeing polio these days. It's not around anymore, and that's because of a mandate. The measles vaccine was mandated, and we've nearly limited that by seeing some groups that are opting not to vaccinate. We've seen some cases that have flared up, and it's scary because of the long-term implications. We are only now 18 months into knowing what COVID-19 does here and now. We're still exploring what the long-term effects are. People speak about the post-effects of COVID or long haul, as they call it. But we won't necessarily know what that is until we're a few years down the road. And I think that whatever we can do to mitigate any risks down the road and how we can protect ourselves and others is really important. And I think this has been mentioned many times, but you have no idea who's immunocompromised. You have no idea who cannot get the vaccine for personal reasons or who maybe may not build such a strong response to the vaccine that puts them at risk. So if you can help protect those around you, I think it makes all the difference.
What has been the response, on to what you're saying, what has been the overall response of healthcare workers and professionals who have heard of this mandate? Has it been sort of like a sense of, you can't mandate this, I'd rather leave? Or are you hearing, sure, this mandate is necessary, I'm going to comply? Which are you hearing?
For the most part, I think healthcare workers have been complying. I think there was a small proportion of individuals who may have had their reasons for wanting to wait. And I think the healthcare system and other individuals are doing a great job at, again, trying to understand where the fears or hesitancy is coming from and addressing that. And I think being in the healthcare system, most people understand the importance of this. So it's been great to see that people are complying.
So if you had to leave the listening audience with some information about how do I learn more about ER on demand or telehealth, where would you direct them to go to get more information?
Sure. So we have a website for ER on demand through Northwell's website. Our phone number is listed there. We have a few of the common chief complaints that we see. And I would say, if you're not sure, you can always call us and we're happy to help. We're happy to see anything that's appropriate and answer any questions that you might have.
What is your website?
So it's northwell.edu, and you can search for ER on demand on our website there.
Thank you for being here, Dr. Shelly Razack, a New York-based Northwell Health physician who specializes in emergency medicine. We hope you stay safe and continue to stay healthy. And thank you for being our guest today.
Thank you so much for having me.
This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the Nursing Department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.